How's it going, guys? Past level question. Endocrine step 1 internal medicine 2CK. 32-year-old woman. Today history, very tender neck. Recently recovered from upper respiratory tract viral infection. Very tender thyroid on physical exam. Vitals are temperature 99 Fahrenheit, heart rate 90, respiratory rate 16, blood pressure 120/80. Question wants to know which of the following combinations most likely to be seen. So, diagnosis, Qbank thyroiditis, aka subacute granulomatous thyroiditis, aka subacute thyroiditis. You want to know that array of terminology because they can give you the same 1-2 liner here, easy diagnosis, and then the answer is just subacute thyroiditis. Students are confused because they're looking for Qbank or they're looking for subacute granulomatous. So just be aware, subacute thyroiditis alone, that truncated terminology can be used. So we're hyperthyroid here because we have a heart rate of 90. So if we look at the TSH for starters, we know that TSH is going to be suppressed, that this is primary hyperthyroidism. The only way you're going to have an increased TSH in the setting of hyperthyroidism is if you had a TRH secreting tumor of the hypothalamus or you had a TSH secreting tumor of the anterior pituitary, non-existent on USMLE, okay? So we're going to have increased thyroid hormone, so T4 and T3 would be increased, and that's going to suppress our TSH up top, okay? Negative feedback. So we're looking at answers of down arrow TSH and up arrow T4 here. So question is, well, what about the iodine uptake? The answer is decreased iodine uptake into the thyroid gland. Holy shit, not increased. Now, what USMLE is going to do, because Qbank thyroiditis, drug-induced, i.e. amiodarone lithium, as well as postpartum thyroiditis, which is aka silent thyroiditis, all of those conditions can cause triphasic thyroid function tests, which means the patient can be hypo, or hyperthyroidism. But the USMLE for Qbank and for postpartum thyroiditis, they're usually going to give you hyperthyroid state. Now, why are they going to do that? I'll tell you why. Because if they give you hypothyroid state, if I give you Qbank with hypothyroidism, wouldn't it be fucking obvious that the uptake's low? So even if you didn't know the physiology, well, you would just choose low uptake because that sounds logical. So they want to test you, OMG, that you know that uptake is low, even when you're hyperthyroid. Now, I omitted the drug-induced from that mini explanation there because I've seen quite a few NBME questions where they'll just say the patient's on lithium or on amiodarone, and they can just ask you straight up which the following most likely be seen as patient, and the answer is hypothyroidism. Okay, when they play around with the arrows for uptake, it tends to be for Qbank. Okay, that's the highest yield diagnosis here. So I'll just recapitulate a little bit for you here that you're going to choose decreased uptake in the hyperthyroid state for not just Qbank, but also amiodarone lithium, drug-induced, as well as silent thyroiditis, aka postpartum thyroiditis, even if the patient's hyper. Okay? In the setting of hyperthyroidism, if you would choose increased uptake, okay, you would choose this answer here, choice E, which is wrong fucking answer here, but I'm just making a point. This would be correct for Graves' disease. This would be correct for toxic adenoma. This would be correct for toxic multinodular goiter. Okay? Choice E, wrong fucking answer. You know the deal. When team make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.